Dogs do get the flu. A Mediterranean diet's good for making babies and risks for kidney donors. News 4 Tucson's Sean Mooney has the latest revelations.
People who donate a kidney may be at risk for some long-term health problems. Researchers in England followed over 100,000 living kidney donors. Over time, donors had a higher risk of high blood pressure and poor kidney function than non-donors. And female donors were twice as likely to develop preeclampsia during pregnancy. But there was no evidence that living kidney donors had a higher risk of heart disease, diabetes, or early death. A new Greek study reveals the importance of a healthy diet for women attempting in vitro fertilization. Researchers surveyed over 200 women about their eating habits in the 6 months before undergoing fertility treatments. Women who ate a Mediterranean diet rich in fruits, vegetables, whole grains, and fish, and low in red meat were 65% more likely to get pregnant and have a child than those with a poor diet. And you may have escaped the flu so far, but have you checked on your dog? That's right, the doggy flu is a real thing. Canine influenza is flaring up in some parts of the country, affecting more than 2,600 dogs since 2015. Now, diagnosing the flu can be tough, but typical symptoms are coughing, sneezing, fever, along with runny nose and eyes. Most dogs recover within 2 to 3 weeks with little or no treatment. But don't worry, you can't catch the flu from your pup, but it's best to keep sick dogs away from other animals for at least a month.